Thank you, Ceann Corla. I think there's two issues here that need to be separated. One is the question of whether there is excess mortality, whether there are excess deaths. And the second question is, if there are, then what the cause of those are. Because I think the two are often intertwined, and I think the subtext of much of the discussion around excess deaths, unfortunately, is an implication without foundation that these deaths, or a significant proportion of them, or whatever, are being caused by vaccines. On the data point, we need to hear more data, but I do think on the data that we have available so far, in particular from Eurostat, there are reasons to say that there is excess mortality in multiple European Union countries. Actually, we wouldn't be Eurostat, but multiple countries around the world, and in Ireland. The point has been made about August 2023, in that month, Ireland having the highest rate of excess deaths at over 20%. We know that life expectancy has fallen around the globe. So I think there is some evidence to suggest that there is something happening here, and then the question is, what is it? And in my opinion, the first and most obvious cause of this rise in mortality is COVID, which did not exist before late 2019. COVID is still a significant cause of death in Ireland. It may be the case that the political establishment, much media commentators, everyone would wish that COVID has gone away. COVID's in the past, something we talk about in the past. But unfortunately, it hasn't gone away. It's simply the policies that have changed, and the policy of effectively letting it rip and close our eyes to it is the dominant policy now worldwide. 954 people in Ireland have died from COVID since the 3rd of January 2023, including 84 people in the last 4 weeks. In particular, a lot of people, a disproportionate number of people, are still contracting COVID in hospitals and nursing homes, where they're particularly vulnerable and where it can result in the deaths of people quicker than otherwise would have been the case. Another explanation that I think is likely to be a factor here is post-COVID morbidity, that you have higher incidences of heart attacks, strokes, chronic diseases like diabetes and neurological problems in the months and years following a COVID infection, therefore contributing to excess deaths. This may even get worse over time as people suffer repeated reinfections. A recent major study found a substantial rise in risk of cardiovascular disease, including heart attack and stroke, for at least a year after COVID infection. For many people, this can manifest as higher blood pressure, a long-term silent killer that can add to excess mortality in later years. Another explanation is delayed access to healthcare, such as delayed cancer diagnosis during the pandemic, leading to less effective treatments and higher mortality. That is combined with a general backlog on the health system in all areas, including of lots of non-fatal areas post-COVID, exacerbated, of course, by years of underfunding, repeated for next year, a recruitment and retention crisis that will be worsened by the recruitment freeze that has been announced, and an increased population over the last few years, which further stretches resources. This has led to very long waiting lists and hospital emergency department overcrowding, both of which lead to greater mortality. For example, the Irish Patients Association estimated in February that A&E overcrowding had caused 1,300 deaths last winter, and the IMO president, Dr. John Cannon, said in April that, quote, "It's now inevitable that overcrowding and understaffing in the health service is causing avoidable fatalities." I also want to link this to the question of long COVID, because I think, I made this point earlier in topical issues, in years to come, I think that we will look back at the current policy around the world in relation to COVID, and we'll see it as a social crime. A social crime in terms of the millions of people who have died from COVID and are still dying from COVID, many of those deaths being avoidable. Also, though, a social crime in terms of the tens of millions of people who are being confined to an extremely marginalised life, who are not able to go to work, who are not able to go to school, who don't have their conditions recognised, who aren't getting the support that they need, and I think that is, really utterly scandalous. People suffering from long COVID have been found to have higher mortality rates. One study of tens of thousands of people with and without long COVID found that people with long COVID had more than double the mortality rate within 12 months compared to those who hadn't caught COVID, 2.8% versus 1.2%. Quote from the study: based on the study, individuals diagnosed with long COVID are more than twice as likely to need care for cardiovascular events and 3.64 times more likely to have a pulmonary embolism. So I think that the likely root of the likely increase, or the likely cause of the likely increase in mortality of excess deaths is pretty obvious. It's staring us in the face in terms of the pandemic that we've been through and the policies that we've decided to follow. I certainly haven't gone along with those, of effectively pretending that this doesn't exist anymore and not taking long COVID seriously. I think there should be a real call on the government and a demand on the government to take long COVID seriously, to implement the measures that were agreed unanimously by this Dáil last November, to properly invest in long COVID clinics, to ensure that they're operating every day of the week, to ensure that they're accessible to people across the country, to take COVID seriously, to take ventilation seriously, to have a reintroduction of masking in healthcare settings, and have education of people of the fact that COVID is still with us, but also of the dangers of long COVID, as well as education of GPs to ensure that people are being referred to the proper pathways for long COVID.